Many clinicians tend to quickly blame the products when they encounter a complication, but the way I see it is a successful procedure consists of two things: 40% product, 60% techniques. So it is not just the product that plays an important role, the technique is incredibly important as well. Let me give you a couple of examples. One of the most common complications we see in the periorbital region with hyaluronic acid filler is lumpiness. But if you think about it, what causes lumpiness? All the different hyaluronic acid dermal fillers have different percentages of cross-link. And cross-link, as clinicians know, the higher the percentage of which will give you a stiffer product that is more viscous. And viscosity in clinical practice translates into the lifting capability of the product, but also in a delicate part of the face such as the infraorbital region, with the skin, the muscle, and the subcutaneous fat being thinner. If you use a viscous product, you're taking on the risk of lumpiness. But even more so if you're injecting the filler too superficially. So the mantra and the philosophy of injecting filler in the infraorbital region is you want to keep it under the orbicularis oculi, and you want to use a product that's been formulated in such a way that it has taken into consideration the unique anatomical features of the infraorbital region. So it's a product that gives you enough lifting capability, but not too high a percentage of cross-link that it becomes too rigid and too viscous. And then you inject it under the orbicularis oculi, you use the muscle to buffer the filler for you, and that will avoid the lumpiness. So that's one. Two, the second one is periorbital edema. And so what causes periorbital edema? Again, we think about the biochemical specifications of filler. And all fillers or hyaluronic acid fillers consist of hyaluronic acid. And we know that hyaluronic acid is hydrophilic, which means it's got the propensity and high affinity to attracting water. So the higher the concentration of a hyaluronic acid dermal filler, and then the higher the affinity to water. Which means when we look at the biochemical specification, when we are choosing a product for the infraorbital region, we want to choose one that is relatively low in concentration of hyaluronic acid, but not so low that you don't have any active ingredient that it's not going to last. So we want one that, my personal preference is Teocel's Redensity 2, that contains 15 milligram per gram of hyaluronic acid, which means it's got the right amount to give you the longevity, but it is not such a high concentration that it increases the risk of you attracting too much hydration into that part of the face. Then, clinicians need to make sure they inject deep under the orbicularis oculi, because in the event, or in the unlikely event that there is too much hydration there, at least it is buffered by the muscle, and it is sitting under the muscle, and you are not going to see the edema. So those two examples are two of the many examples we see on a day-to-day basis when we get referred complications, that the clinician or clinicians are quick to blame the product. The product plays a certain role in minimizing complication, but at the end of the day, it comes down to the technique and accuracy of injection as well. So my advice for clinicians who are watching this interview is, gone are the days when we look at the brand of filler and then we associate a brand of filler with a specific region of the face. So for example, some clinicians ask me, Dr. Bong, do you use Mickey Mouse brand for the infraorbital region, or do you use Donald Duck brand for the cheek? I think we are more clever than that. We need to study the biochemical specifications, we need to get to know our product, and then we refine our technique to give you the best of both worlds, and that's when you give the best result that is safe and effective. Some of the side effects and complications in the periorbital region is as a result of the hydrophilic nature of hyaluronic acid. Hyaluronic acid, if you think about it, why is it nowadays we see hyaluronic acid in skincare product, in just about everything? This is because we've come to understand that this magic ingredient has very high affinity to water. But equally, if we use a product that contains too high a concentration of hyaluronic acid, it is also going to increase the risk of it attracting too much water into that part of the face. If it's other parts of the face, then perhaps you can rely on slight excess in hydrophilic nature of the product to give you the plumpness and the result you're looking for. But the infraorbital region is very unforgiving. It is the part of the face that is very confined, the skin is thin, the subcutaneous fat is thin, and the muscle is thin. And therefore, if you have too much hydration there, it is going to become visible. And then it is also a very visible part of the face, which means in clinical practice, if you cause any periorbital edema, your patients are going to be very, very unhappy. I'll give you an example. We have three most popular brands on the market. We've got Juvederm, which contains 24 milligram per gram of hyaluronic acid per syringe. We've got Teosyal Pure Sense range, which contains 25 milligram per gram. And then we've got Restylane, which contains 21 milligram per gram of hyaluronic acid. Why is it that they have different formulation? That's because the concentration of hyaluronic acid matters. So when we look at products such as Redensity 2 from Teosyal, the reason why it's the only product that's been licensed for injecting and rejuvenating the infraorbital region is because it's been exclusively formulated with the infraorbital region in mind. And one of the exclusive unique features of Redensity 2 is it contains 15 milligram per gram of hyaluronic acid instead of in the 20s or in the 30s. That's because the engineer who designed for Redensity 2 understands that in this part of the face it is unforgiving. If you have too high a concentration of hyaluronic acid, clinicians will be taking on too high a risk of periorbital edema. So to reduce the risk, you reduce the amount of concentration of the hyaluronic acid, but keep it at a level that gives you the right amount of longevity and the right amount of effectiveness.